Well, welcome. When I think about healthcare moving forward in the future, I think about the 3 E's: effectiveness, efficiency, and equity. And it strikes me that at a meeting like this, we spend a lot of time talking about effectiveness and efficiency, but not that much time talking about equity. And pursuant to that, here are some statistics from the WHO. Each and every day, 21,000 children, every day, 21,000 children under the age of 5 die from pneumonia, malaria, and diarrhea. If you live in the countries considered among the 20% wealthiest countries in the world, you've got a 2 times better chance of surviving to age 5 than those that are living in the 20% poorest countries in the world. 70% of cancer deaths are in middle and lower income countries around the world. And in these countries, only 30% offer comprehensive cancer care, while in the medically developed world, 90+% offer comprehensive cancer care. Only 1 in 5 middle and lower income countries even collect enough data to drive cancer policy. So, in the richest country in the history of the world, sitting here at this meeting, we might find these statistics somewhat difficult to deal with. And we might contemplate how better access to technology might have changed those statistics in the past and could change them moving forward in time. The sorts of technologies that are being displayed and discussed and evaluated here at RSNA. So Dan, first of all, I'd like to say congratulations on your efforts. I think RAD-AID is an incredibly innovative endeavor. But those that study innovation say you got to go through 4 phases for something to be qualified as a real innovation. First, you have to have an idea. Then you have to make that idea real in the world. You have to invent it, so a prototype for a device or a pilot for a process. It has to be adopted. Then it has to add objective value. And if it doesn't go through those 4 steps, it's not an innovation. So let's walk through those 4 steps, and I want you to tell me how RAD-AID has moved through that process to be the innovative endeavor it is now. So first of all, how'd you get the idea? And what is it?
Well, thank you, Roy, and thank you, Phillips, for hosting the fireside chat with RAD-AID. Thank you, everyone at RSNA for listening to our session. It's a real joy for me to be here and representing RAD-AID and working with Phillips. And as said before, I'm just one of now 8,200 people that are in RAD-AID working on these initiatives. So I don't even know if I feel comfortable even talking about what my role was in any of these ideas, because it is really the 8,200 people that are volunteering in RAD-AID that do make it work. I think that the cornerstone of how we do this comes from radiology readiness, the assessment tool that we use to match resources that exist at hospitals to build healthcare capacity that match their long-term goals. This is how RAD-AID works. We start every single program with an attempt to analyze what's already there in radiology and see how we can best supplement those resources to make it work out. And this is how RAD-AID has scaled throughout the world. It starts with this because you're offering solutions that these hospitals intrinsically need. And that's how we've grown from just a few of us in 2008 to what you see here in 30 countries in 47 hospitals. Because each solution is tailored to how radiology can best impact those communities at the hospital level. And this is where the growth has really come from. It's being the ability to empower the radiology community at the technologist level, at the MDs, nurses, technologists, and going on into IT and public health, so that they can use their own resources to work within RAD-AID's platform for making that possible. And I think that's where the scale has come from.
Got it. So you answered the first 2, the question about where the idea came from and how you encouraged it to be, real in the world. Let's talk about the value proposition. There's obviously huge existential value to improving healthcare equity, but do you have any statistics or any sort of objective information you can give us about all the good work that you've done?
Well, we can look at one program in particular which Philips has been a supporter of since 2009. The Asha Jyoti Mobile Health Program for India has now taken care of 19,500 women. You can see the image behind us. The radiology readiness assessment showed very high mortality and gaps in cancer treatments available for women in underserved areas of India. We did those assessments at over 10 hospitals, but we identified the very best that we felt that we could work with as stakeholders. And then by doing that, we designed a mobile solution with you that ended up bringing about this type of change. So when you think about 19,500 patients all coming through a truck just like this, and you can see some more pictures of the complexities of that workflow and what it means to engage women who've never really seen doctors before, potentially, or who've never been screened for cancer. Then they are referred on to the tertiary care center that we partner with so that they can receive definitive treatment. So it's not just about putting the equipment there, it's about the training, the resources to treat them, and then referring those patients so that they're always receiving close follow-up care. And I think this is one example that I would point to as a way of showing that. And now it's been so successful that another province in India has asked us to expand and replicate this program that we started with Philips in the Maharashtra region, where if we scale it so that the same effect that was in Chandigarh can now be in the regions near Mumbai, we can replicate that effect.
What parts of the world are you not in now that you would like to be in or planning to be in the near future?
It's hard to imagine an answer to that, because with 30 countries and 47 hospitals, like, should we really add any more? But we will keep adding more, and it's one of those constant questions that boggle the mind, because we continuously get the inquiries. So for example, in the last year, we've seen a rapid rise of inquiries coming from Eastern Europe, Bosnia, Albania, Ukraine, as examples. Now, these are not countries that typically are thought of as being in the global health side. You know, usually we think more about Africa and Latin America. But I think that's one example of a region that is already having declared itself to RAD-AID in the request to do our assessments and then offer solutions. I think we've also seen a rapid rise in requests coming from East Asia. So in Laos, for example, or in Vietnam, where we've been helping hospitals engage more equipment and put more training in those locations. So I would say that our opportunities to expand have been in those areas. A big country that always has a debatable, some areas are very underserved and some areas are very highly served. In China, for example, RAD-AID is very active in underserved areas of China, in the central and western portions. And we think we'd like to continue doing that as a way of engaging those hospitals that are trying to bring about change. Here's another example of Philips CT scanners being donated into some of our hospitals where we do serve in Haiti and Guyana. And this has a major impact if you look at this map, because it's not just about adding more countries, it's also about adding more sites, more hospitals. Because if you see here, there's a lot of hospitals that we're not in, just in this one country. But if we're donating these CT scanners, the opportunity there is to create linked networks, where a CT scanner in one location can then benefit the training and care that goes on in another location.
So this is obviously a very compelling idea, and you've been very successful deploying radiology equipment, diagnostic equipment, training personnel. What's the next couple of iterations of this? What do you have planned beyond this? I mean, the need is tremendous. It's not just diagnostic information, it's also treatment and other technologies and expertise. What do you have planned beyond this, or are you maybe planning partnerships with other organizations to be more comprehensive?
Right. So RAD-AID is a World Health Organization affiliated entity. We are UN affiliated. So that has given us a scale to continue looking at how we can expand these programs in other countries. If we think about another example in Guyana, it's stirring local investment. When you offer a solution, but at the same time you offer a reciprocal way for them to give to themselves and to invest in their own care, I think that's a model that RAD-AID would like to develop further. So here's an example. If you give a CT scanner to a place, you say, well, here, we'll drop it off. Good luck with that. That's not the way it's done. So if there's an agreement in place that really looks at what they can do in return, this is what ends up happening. They build the CT scanner unit and the suite. They start digging into the brick and mortar to create that capacity. And that's what I'm hoping to do, is that by having a model that meets halfway and always stirring that reciprocal relationship at all times. And I think that that's something that I'd like to see continue.
Great. So it strikes me that you potentially have a huge recruitment opportunity at RSNA for other partners, or perhaps for individuals that are interested in not just thinking about the first two E's of efficiency and effectiveness, but maybe are concerned about the inequity of healthcare around the world. And so how can individuals or other corporations other than Philips get involved?
So we have a variety of exhibits throughout RSNA. So our main information booth is in South Hall and Publishers Row. Going there, learning about our programs, picking up some materials is a great way to just sign up and get involved, because we announce every month about 5 new projects that are coming out and teams that are undergoing recruitment. And that is no matter what background people are coming from. So that's the way to participate as a volunteer in getting involved. The other project that we have on display is what we have behind here. Over at Bear in the coffee area, there is a model of our Airship program where we're showing how we're innovating on the aircraft side. And I'm pleased to say that Philips has also been a supporter of this aircraft program. We're working on that, how mobile deployable systems can be made remotely accessible in areas that you can't land a conventional airplane in. So we have a model of this right nearby, and Philips has been a great supporter of that. And I think we're also offering a mobile health truck, which you can go see in the North Hall in that corner, where this is using tomosynthesis, 3D mammo, along with ultrasound, with a uniquely designed mobile health truck that integrates machine learning and AI into how we reach to those communities. Even an example like this, where we use geographic information systems analysis to find underserved populations that we can help. That mobile health truck is kind of another way that we're thinking about that. So you can visit the Airship, you can visit the mobile health truck, you can see any of our presentations, and then sign up over in South Hall.
Great. Well, I'm going to give the audience a chance if anyone has any questions for Dr. Molurra about RAD-AID. Any questions? Would anyone like to volunteer right now to participate?
Yeah.
Very good.
Operating officer
there you go.
wants to volunteer. See that?
So I'd like to invite you all, if you haven't done this, to look at the WHO Sustainable Development Goals. The UN Sustainable Development Goals, United Nations. And to remind you that 3 is a magic number. 3 is a magic number. The third goal is to improve the health and well-being of all individuals in all places in the world. RAD-AID is doing that. Philips is dedicated to that, with our goal to improve the lives of 3 billion people by 2025, and I'd like to invite you all to be involved too, so thanks very much.
Roy, thanks for having me.